Welcome back. In this video, we will compare asthma versus chronic obstructive pulmonary disease. Two major chronic respiratory disease, we will look at their differences in definition, age of onset, pathophysiology, symptoms, spirometry findings, treatment, and prognosis. By the end, you will never confuse them again. Asthma and COPD are two chronic airway disease. Asthma is reversible, while COPD is progressive and often irreversible. Definition: asthma is a chronic inflammatory airway disease with reversible obstruction, often starting in childhood or young adulthood. COPD is progressive airflow limitation, usually affecting people over 40 years, especially smokers. Causes: asthma is caused by allergens, environmental triggers, and genetic predisposition, leading to bronchial hyperresponsiveness and irreversible bronchoconstriction. COPD is caused by smoking and air pollution, leading to chronic inflammation, airway narrowing, and alveolar destruction. Symptoms: asthma symptoms include intermittent wheezing, chest tightness, dyspnea, and cough that worsen at night or early morning. COPD causes a persistent productive cough and progressive dyspnea. Spirometry imaging. In asthma, spirometry shows decreased FEV1 but marked improvement after bronchodilator use. In COPD, there is little improvement. Chest X-ray in asthma is often normal, while in COPD it shows hyperinflated lungs and flattened diaphragm. Histology and exacerbation. Asthma shows eosinophilic inflammation and thickened basement membrane. COPD shows neutrophilic inflammation and alveolar wall destruction. Typical of emphysema, asthma exacerbation are triggered by allergens or cold air, while COPD is worsened by smoking and infection. Treatment: asthma responds very well to inhaled steroids and oxygen therapy is rarely needed except in severe attack. COPD responds variably to steroids and long-term oxygen therapy is often required. Prognosis is good for asthma with control, but COPD progressively worsens though smoking cessation improves outcomes. In short, asthma is yearly, reversible, and allergic, while COPD is late, smoking related, and irreversible. Always distinguish them clearly for exams and clinical practices. And that's the key difference between asthma and COPD. Remember, asthma is reversible and often begins early, while COPD is progressive, smoking related, and only partially reversible. Mastering these differences is essential for exams and practice. Thank you for watching the rising nurses, next generation nurses. Stay tuned for more clear and a simple nursing lesson.